Hi, my name is Grace Yeager, and for my sports injury assignment, I decided to do dislocations. Okay, so starting off, what is a dislocation? So, a dislocation is an injury that will literally force your bone out of position, whether that's out of a socket, out of the joint. And these can be caused, for the case of this assignment, sports injuries, obviously, but it can also be caused in other ways by slipping and falling off a chair, getting in a car accident, just anything that's going to put force onto your joint bone area. So it mainly involves the body's large joints like the shoulder, the elbow, the knee, the hip. For adults, the most common site of injury is in your shoulder, and for children, they mainly get dislocations in their elbow. And dislocations are classified based on how far the bone was moved in your joint. So a full dislocation is called a luxation, and a partial dislocation is called a subluxation. Okay, so now it's obviously different muscles and bones affected for every single type of dislocation you have. For the sake of time, I'm just going to name a few from each type of dislocation. And I'm going to read directly from the list from this because there's just so many, I don't have all of them memorized. So starting off with shoulder dislocations, the rotary cuff muscles are affected, deltoid muscles are affected, pectoralis major, biceps brachii, traps, rhomboids, latissimus dorsi. And I'm sorry if I'm mispronouncing any of these. The bones, these ones are easier. It's your shoulder, it's your humerus is popped out of your scapula. And then there's a little image right up top of a shoulder dislocation. For your elbows, the muscles affected are the brachialis, biceps brachii, triceps brachii, pronator teres, flexor, pronator muscle groups. And then this one's easier to memorize. The bones affected are your humerus and your ulna and radius because obviously they're popping out of that joint. And then there's another image. There's also finger dislocations, which is obviously smaller, but the muscles affected are your flexor digitorum superficialis, flexor diaphragm profundus, lumbricals, and lateral bands. And then obviously the bones affected are your metacarpals and your phalanges, and then there's a nice image of that. And there's also hip dislocations. Your muscles affected are your gluteus maximus, your iliopsoas, your prefemoris, quadratus femoris, abductor longus, and rectus femoris. And obviously the bones affected are your femur and your cerebellum. And there's a little hip dislocation. And then lastly, there are more types of dislocations, but I just kind of did the 5 major ones, is ankle dislocation. And the muscles affected, these aren't all, I only listed some as I said. Gastrocnemius, soleus, tibialis, peroneus longus. And the bones affected are the tibia, the fibula, and the talus, and then there's an image of an ankle dislocation. Okay, so getting into the symptoms, obviously the most common obvious symptom of a dislocation is when you can visibly see that it is not where it is supposed to be. For example, the shoulder, that is clearly not right, and then the fingers bent, that is just an obvious symptom that you have a dislocation. Some not so obvious symptoms are numbness or tingly joints. Obviously, it's going to be painful, limited range of motion, and swollen or bruised. So there are many options of treatment for dislocation. The first one, I feel like this one's kind of common. It's repositioning it. So here's an image, the far left, of a doctor just kind of repositioning the joint back into place. I think you can do this on your own, but I definitely would recommend going to a doctor to get this done. Another common one is splint cast. It just keeps the joint in place while healing naturally. Next is medicine. This obviously isn't going to solve the problem, but it will reduce the pain as you are experiencing the pain. And then another thing is called a traction. It kind of stretches the joint and pulls it back into place, which is really cool. I never heard of that before this project. And then surgery, you only get surgery for a dislocation if you keep having the same dislocation occur. Like if your shoulder keeps dislocating, they will bring you into surgery to permanently stop the issue. So ways you can prevent dislocations, just don't do anything that could put you in risk of falling. Like, for example, you don't want to just stand on tables and chairs if you don't need to. In sports, specifically, because this is a sports injury project, you want to wear all the correct equipment, such as some people need to wear, like, those hand things. Some people need to wear ankle braces if they have a loose ankle, knee pads, whatever. Just make sure you are wearing the proper equipment. Another way is just to prevent the risk of falling, so removing electrical cords from floors, use handrails on stairs, and using like the non-skid mats on the bottom of bathtubs. Here are my citations, and I hope you learned something new about dislocations.